My name is Nicole, and I'm the program manager for online training here at Glidewell. It's my pleasure to introduce Dr. Neil Warsofsky. He is a leading orthodontist, educator, and innovator with over 26 years of experience. He is a graduate of the University of Illinois with 5 degrees. He specializes in customized, cosmetic-driven orthodontics care powered by advanced digital workflows. He also serves as an associate professor of orthodontics at the Craniofacial Center at UI Health, where he manages complex cleft and craniofacial cases. He's a global lecturer, a published author, and a pioneer in aligners, lingual braces, and skeletal anchorage. We're thrilled to have you with us today. I'm going to turn things over to you, and we can get started.
My name's Neil Warsofsky. Everyone calls me Dr. Neil. I go just by my first name. I'm a pretty casual guy. I have been printing for a long, long time, since probably 2014. And I've been digital scanning since 2011. And I've been paperless since 2006. So this is just sort of kind of like makes sense to me, right? Like it's the only way I know how to work. And I think learning to print, if you've never done it before, is a very daunting concept because there's a lot of variables here, right? Like equipment, resins. I don't understand how to upload it or stuff like that, or how do I design it? So what I always tell people is one of the very first things I learned how to do was how to make a night guard, because night guards traditionally in my office, we made everything. I'm an orthodontist. So, my lab would take 2.5 weeks to make a night guard because we would take alginates and we would duplicate them. We would mount them on an articulator. It was a good night guard. We had 3 layers of acrylic on it. And, we were very proud of what we did. I mean, they would last, 10 to 20 years if we made them well. Sometimes, it was really fascinating. But, we never made any money on them, but I would make them because I thought people needed night guards. And at the time, I just kind of believed in, making my own lab work. I still do for the most part. And, when the concept of making the night guards digitally came around 2018, 2019. I got very curious with it because the person who was making my night guards was threatening to retire, which in fact she did do. And I just said, okay, this is stupid. I have to learn how to do this. So I'm hoping my experience will make you understand why you should do this. Now, if you do this right, I think it's a good appliance. It treats a lot of issues. And most importantly, what you'll appreciate is this is a profit center for your practice. So with that, let's get rolling. So again, my name is Neil. I am a practicing orthodontist here in Chicago. My private practice is Get It Straight Orthodontics. I've been very, very, very fortunate to make friends with a group called LuxCreo. I think they, hands down, unquestionably make the best printing system in the entire industry. That's dental, restorative, orthodontic, you name it, lab-based. I think they just completely get it. I think they are the unicorns in printing right now. I think they move incredibly fast. They're innovative. They never accept no for an answer. And, I'm really excited to be partnered with a group like this because I needed a printing solution that had that integrity that can create what doesn't exist currently to move forward with technology in my world. So all that being said, thank you for the opportunity and invitation to speak. And my program is being generously supported by both LuxCreo and Glidewell. So Glidewell is in partnership with these guys, and they have taken the LuxCreo complete ecosystem, which looks something like this. Oh, I'm sorry. I'm still on my own stuff. Sorry. So I, like you heard earlier, I work at the University of Illinois. I actually work in dental school for the hospital in the Craniofacial Center. I work right next door to orthodontics, and we see entirely surgical cases. So birth defects, traumas, cancers, gunshot wounds, horrible accidents, skydiving accidents. I mean, you think of something bad and they probably cycle through my clinic in one way or another. So in the middle, the second picture from left, you can see some of my team members of my practice. We're a tight-knit group. I've got great retention on my staff. People are with me almost 30 years. I've got, a couple of newbies, but very dedicated staff that really believes in the mission that we do. A picture next to that, you can see 2 out of 3 of my kids. The one on the right is second year resident in orthodontics. I'm happy to work with him in the future and super stoked to do that. My daughter on the left there, she is a practicing lawyer in the city of Chicago. And then picture on the right just kind of shows me with a couple of my buddies skiing. To let you know, I do have a life, not much, but whether it's skiing or barbecuing or photography. I'm an outdoorsy guy. I was associated with Boy Scouts for quite a long time. I love anything with woodworking. I'm a very staunch Chicago Cubs fan. In my office, you'll see in a moment, is pretty close to Wrigley Field, and in the summer I have a log cabin which I'm actually broadcasting to you from right now. So that's a little bit about me. Anyways. Our practice is literally walking distance to Wrigley Field. So if you look all the way top left, you'll see where my office is. And if you follow the straight line, which is called Waveland Avenue, straight across to the right, you'll see a green icon for the Chicago Cubs, and that's Wrigley Field. And it's a big part of our identity because we are, I'm a startup practice, and I identify with Chicago as being part of my history and my makeup. So today we're going to talk about fabricating night guards, and I think it's really this is meant to be just a really simple solution. It may not be the exact night guard you need, but I'll show you other ways to get something a little bit more custom, if you will, that where you can kind of dial some other variables in if this is too simple for you. But this is a very good start to learning to use guards in your practice. So one of the reasons why I'm drawn to LuxCreo simply is the fact that they are not just a printer, they are a solution. They've custom made resins, for most popular, needs in our world. So that would be, in my world, we use, you can see these bottles here, DNG is direct night guard. That's what we're going to talk about today. DCA is direct clear aligner. That's for printing a clear aligner. That whole concept of printing a clear aligner, they wrote the patents on this. No other company wrote the patents. LuxCreo actually invented the industry. And as such, they've got really deep knowledge about this. They have their own model resin. It's kind of a cute mango colored. They make all kinds of other stuff, but then they're also private, they take private labels like Glidewell resin or other brands of resins, and then they validate it on their system. So it's not just that you have to use their resin, and their system is matched, right? So the system it's designed as a printer. It has an ultrasonic mechanical alcohol wash. It has 2 washes in it, then 2 different curing systems follow that depending on the material you're using, and it's all in effect to make these appliances in-house and quickly. And I would say our workflow, start to finish on a night guard, I can just about knock it down in about an hour and 15 minutes, soup to nuts. So if I have to make somebody a night guard the moment I'm in the chair, if we get the scan and we acquire the scan, we can literally hand them back the night guard in under an hour and a half, which is unbelievable. But here you can see the whole ecosystem where, they are not afraid to use other brands of material like Pacdent or, I think Rodin's a very popular base for dentures, or, Titan for teeth, or, they make a Trian resin as well, so I think it's really important to understand that they are not so arrogant enough to think that you must buy their product. I think what they said is, we just make the best printer and we want to be your go-to solution for printing anything. And that's kind of like what I migrate to. I want to have a company that doesn't tell me that I must use something. On the other hand, when you talk about Glidewell, which is such a massive lab concept, they're so big that they said, well, hey, look, we'll private label this printer. We'll make really kind of one-step software, which is what we're going to talk about right now. And that matches with their fast scan software, which is just taking a Medit scanner and they took all the variables away from it. So again, if you have the entire solution from Glidewell, you might have a fast scan Medit scanner, which then will feed us that STL file, if you will, into a workflow that we're about to go through, and you'll output at the end of the day just a simple hard night guard. So let's get started. So I'm going to talk about two different workflows, okay? Because I don't want you to have to be pigeonholed into only working with the Glidewell workflow, because it is a simple workflow. You don't have a lot of choices here. So if you want to make something thicker or thinner, you'll have a hard time using this software. This software doesn't allow you to do that. On the other hand, the second workflow I'm going to show you very briefly is made by a company called 3Shape, and the workflow is called Automate. And they have a very, very deep knowledge about this stuff because they've been doing this for a very, very long time. So if you want something that's going to play a little bit more customized, I think I'll give you two different options, and you can just kind of pick and choose what you want to do. Either way, once you design the night guard, you're going to output a physical file for the printer. That printer is then going to automatically nest it, as we say. It's going to mount it, and then you just hit basically the print button on the front of the printer. It just comes out about an hour later, and then you'll go through the process of washing it, removing it, and then putting it in a cure box. And what's interesting about the LuxCreo printer is your night guard's going to basically print polished. And it's a concept they call digital polishing. And I cannot say enough good stuff about this. So if you are in an area where you don't have a lot of space for your lab equipment, I got to tell you, this is kind of a game changer for you, because you don't need the whole lathe and pumice and all that stuff. You can just pretty much almost take this thing once it's cured, just take it off the support structure, polish that one little area, and it's deliverable. And that is a first of its kind. So I want to concentrate really, for the most part, on the first path, which we're going to refer to as the one-click solution. And it's part of a process that Glidewell has created called Fast Design. The .io stands for in office. So again, you don't have to own the printer. You could use this software and you could send it somewhere else to print, like such as Glidewell or any other local printer lab area that you have. But I think the point here is like they want to give you the ability to do this, because I think the sexiness here is if you meet somebody, I usually tell people, like, why don't you go get some coffee, have a seat, play on your phone for a little while, and I'll be ready to deliver in an hour. And we literally flip things in under an hour in our practice, oftentimes. So here's the concept, right? The doctor meets the patient. We have this discussion, and we say, Mrs. Jones, you look like you got a lot of excess wear here, or we're finishing up your orthodontics, and we notice that you're starting to put holes in your retainer already. So we want to make something a little more durable that'll last, hopefully, several years for you, right? And one of the goals here is that if you're a good minion here and you follow my advice, we'll keep you out of trouble and we'll keep you healthy. So as a result of that, I would like to offer you a night guard. I think a night guard will be custom made for you. We can do it today. You can receive it today. Okay. You don't have to make a second visit if you don't want, which is a big selling point, right? So Mrs. Jones consents, someone comes in, talks about fees, signs a HIPAA release, whatever, we get permission to go. So we'll put the person in the chair. We have a dedicated records room in all of our offices, or at least our two bigger offices have dedicated records rooms where they have a chair literally designed only for scanning and for photography. And so we send them over there. They'll scan it. The scan is immediately in the cloud. And then we're going to send the scan from the cloud into the Fast Design software. So this is the process that we're going to follow. So when you when you click on the icon on your desktop, this is what it's going to look like, fastdesign.io. You'll sign in using your email and your password. I usually click the Remember Me box because I'm not the only person using the software in my practice, and we just want to kind of get in and out as fast as possible. So when it opens, you'll come to a desktop. Looks something like this. You can see the cases you've already done, okay? Today, it's kind of funny. The top patient is the patient we're going to design today. This is my buddy's wife, Linda. Happened to have dinner last Saturday night with them, and she was describing all the classic symptoms of TMJ. And I looked at her, and you know, she's complaining about how she just had several $1,000s worth of MRI. She's got a swishing in her ear. She wakes up and her muscles are sore and she doesn't know what to do, and she's taking all this Advil. And I've told her this before, but she's just kind of slow to accept it, but I think she's ready to accept it. And they had just come back from vacation, so they were like very relaxed, but she was getting ready to go on a work trip Monday, and she was already tensed up and her jaw was starting to give her trouble again. And I said, Linda, I'm like, let me help you. I'm like, literally, you know, so we're going to design Linda's case. So when I told her husband that I was doing this for fun, but I'm going to really produce this, he was very thankful. So on the upper left corner here, you'll see it says create case. So we're going to create a new case here. So let's click that button. It's going to take you to a new window. Okay, now this is our design window. Okay, so the very first thing that's going to happen is this box is going to pop up, and we're going to be like, who are we talking about, right? So you'll put in your patient's name and you'll hit continue. I don't think there's a very fancy way to describe that. Okay, so now that we're in the design software and we know it's going to be for her, now we have to tell the design software what we want to do. Now there is two different concepts here. One is you can do something fixed. If you have a mill attached to your software, you can be milling crowns or inlays. We want the printer, okay? We want the printer to print us a solution here. Now, the printer only makes two things. It'll either make a retainer or it'll make a night guard. Depending which one you choose, you have to choose and make sure you have the right resin loaded in the printer. The system will not print if the wrong resin is in it, which is just a nice fail safe, okay? So we're going to open up this and we're going to now edit this to show that we want to make a night guard. So when you hit edit, you know, now I'm going to open up a second window here. This is my download window where I just downloaded my files for Linda Shellist. Why I did it, and this, by the way, I said, this is a real working case. This is what I did after last Saturday's dinner with them. So what I did was I had Linda stored in the Medit link in the cloud. So I just downloaded those files, which are here. And then you can see on the left side of the screen here, right over here, it'll say add files. So you just got to click on that. You got to highlight these two files, and then you got to hit open. Okay. When you do that, you can now see the files are resident in the program. Okay. So now Fast Design is open. It knows your patient's name. It now has the STL files. The STL file is required in order to print something, okay? That's the file that we use when we're printing. If you're talking about a 3D X-ray, like a cone beam X-ray, the files tend to be DCM files, right? These are all 3D files, but in the print world, STL is what we use. So here we have now an open window. We haven't told the software what to do yet. So now, if you go to this part right here, you click on 3D printables, okay? Because remember, we're going to print. We're not going to mill. Or another way to say it, there's additive and subtractive manufacturing. Milling is subtractive. Printing is additive. This is an additive solution. So you can see you only have two choices here, right? You can either do a bite splint. Oop, hang on. Let's go back up there. Sorry about that. So you can see you have a bite split. Oh, sorry. Let me think. Let me get out of this for just a second. Go back up 2 slides. Sorry about that. It's faster to do that. So again, what you'll see here is you have two options. One is a bite split and one is a retainer. And again, two different concepts require two different resins on the LuxCreo printer. we are going to use something called DNG, Direct Night Guard is the resin we're using. So we choose the night guard, it's highlighted. And now, as a result, it now says bite split. Now you want to highlight where you want the night guard to go. So you would highlight, in this case, I want to make it on the lower second molar to second molar. So you would highlight tooth number 31 and you would highlight tooth number 19. When you do that, they light up and it kind of gives you a cartoon character of a drawing above the teeth. That's representative of your night guard. So now you know that the software understands that's what we're going to do. It's also telling you that we now have a bite split or a night guard ready to print. Okay. So this is really ready to go now. Okay. And when you believe that you're ready to go, the next place you're going to go is design this occlusal appliance. I might have duplicated that. Okay. Okay, so in this case, you'll click on this. Yep, there we go. You want to make sure that, again, the night guard's on the lower, which you can see by the picture here, right there. You want to make sure that it's for Linda. Here's Linda right here. Okay. And you want to make sure that your STL files, both upper and lower, are here. Now, if you have bite registrations to go with this, you can include them as well. You don't have to, but I usually would. So when you click on this, okay, you'll click on this button right here because everything's ready to go. It's going to take approximately 1 minute to design, okay? And in that minute, you're going to see it's going to come up and tell you that you have a night guard ready to go. Now, if you're using the whole design system from Glidewell, it'll be one click to print and it'll go straight to your printer. And then you just have to touch the front of the printer and it will print. In the event that you want to design a night guard that has maybe some more choices, okay? For instance, you want to be able to either see how thick it is or you want to make it a little looser or tighter. What you can do is you can use a piece of software called Automate by 3Shape. So this is the Automate desktop. It gives you a lot of choices, okay? So and by the way, you can print models as well with fast print. It'll automatically give you a set of study models if you just click the box. But again, today we're really talking about building the splint. So you can see, kind of the same idea. We saw, that in the fast design software, if you want to make an inlay or a crown or something, you would be connected to a mill. In this case, in 3Shape, same thing. It's the same type of software. They're saying, you can mill a crown, you can mill a coping, you can make a night guard, you can do study models, you can do lab models for cases, stuff like that. Your choices are a little bit deeper though, right? The most important one I would say here is how thick the appliance is, right? And that's a generalized thickness based at the first molar. The offset is what we call the gap. So gap is basically a very, very small space between the appliance and the teeth, which you basically have to have. Otherwise, the appliances just fit too tight. Most of the times, I don't touch the offset in this software. Blackout is really important if you've got a periodontally involved patient. The more black triangles you have between the teeth due to bone loss and bone loss and stuff like that, the more you need to block these crevices out. So you'll for an older patient who's had some perio surgery or work or has bone loss, you want to set this crevice blackout to high. The minimum wall thickness is how thick is the buccal wall of the appliance of the night guard, and you can make it thick or thin. It's going to be parallel to the teeth, so it's going to be sculpted like the teeth. It won't be a smooth wall. The inward retention simply talks about how much it's going to grab the teeth. Oop, sorry. And then you'll have the option to put a name tag on it. This is quite simple, just pick an upper or lower. And almost all these are going to print on a 45-degree angle. So this is a little bit simpler though, as much as all those choices are there. All you got to do is just take your STL files, if they're in a zipped format, and you'll drag them into this box right here, and it'll automatically upload and design. In this software, you must accept it. And when you accept it, you'll get charged. If you don't like what you see, just reject it, and there's no cost to you. One of the nice things about this software is you can save a little bit of money if you don't need it done right now and you don't need it back within 10 minutes. They'll do 10 hours and you'll save about $4 or $5. So again, nothing crazy here. These are just design platforms, all tools, if you will, digital tools to help you build what you need to build. When it comes back in 3Shape, you're going to see this window. This window shows you 4 different choices. If you put something up and you're not sure if you even want to design it, you just leave it in there. You don't have to do anything with it. It'll just sit there. The second option shows you that the Nightguard's designed. You need to open it and approve it. Once you approve it, a fifth little bubble will open up, which will say download, and it'll show you the cases ready to download. And then the last 2 options are the cases you've worked on today and the cases you've worked on in the last 3 weeks. What this won't do, it won't save data more than 3 weeks. So if somebody comes in and they had a Nightguard made by you and they come in like a year later and they're asking for a replacement, if you didn't save your file or you don't use the same computer and you can find the history on that, you'll have to redesign it. So there's no history on this one. But this is what the approval window will look like in Automate. It'll show you a picture. These 3 little slider bars right here will allow you to make the models disappear or make the Nightguard disappear. And you'll be able to kind of just determine whether you like that or not. So I want to show you just in general how if you have the one-click solution, there's really nothing to show. You hit print and it just goes. If you're using the LuxCreo workflow and you don't have the one-click solution, let's say you need to print a Nightguard and you're going to print it through the LuxCreo. I just wanted to show you, like in a quick 1-minute video here, how we print something. Hopefully the audio is going to come through here. Let's see. Okay, so in this video, we're going to show how. Is my audio working? I can't tell if it was or it wasn't.
It was, yes.
It was. Okay. All right, great. Then let me go back here and I'll just, sorry about that. Okay. So let me bring that back. Okay, so in this video, we're going to show how to set up the Nightguard print. So I've opened up LuxFlow, and you can see a couple things that you need to understand. One is the application is set on Nightguard, and the material we're going to print is called DNG, which stands for Direct Nightguard. And now you're going to add your file folder in, so you can save this, okay? So go over here, we're going to pick the double line support, which is the easiest and simplest way to support your Nightguard. You'll go into the import file. I happen to have just downloaded my file. So if I go over here, we're going to use Carl Williams just as an example. So it says Nightguard, highlight that, you hit open, and then hit confirm. Make sure you got one click clicked, and that will automatically build your build plate for you. And you're going to watch the line supports automatically get added underneath your your night guard, and it's going to be set at a 45-degree angle. Now, if you don't have a mouse, you can just click any of these views here. It'll kind of move your view so you can understand it. If you do have a mouse, just right-click, move the box around, look for the blow it up a little bit, and you can see this little box right there. Move that, and then you can move this around on the build plate. And in this case, you can see it says Nightguard right here. But if you want, you can also label your Nightguard by putting someone's initials on it or something like that, which would all go kind of like right here on the sides. But this is it. So everything looks good. All you gotta do literally is hit slice. When you hit slice, it will automatically go to your printer. Or if you want to save it and print it at a later date, go up to File, hit Save As, then you can name your job. In this case, we're going to call it Nightguard Demo. Okay, so you just saw how I pretty quickly got a Nightguard loaded on the printer in under a minute, or roughly about a minute. So I say, like, this is really just a really clean workflow, and it's why we use it. So, so when you're thinking about the bigger picture now, again, here's one of the blessings about all this. You're not married. Listen, if you have the entire Glidewell ecosystem, you're using their fast scan software on a meta scanner, and then it's connecting to fast design, which is then going to put it into fast print using a LuxCreo printing solution. And it's a very clean, very direct path of success here, because there's just not a whole lot to do where you can screw it up. When it comes out of the cure box over here, I would say an average night guard could take you 10 or 15 minutes to remove the supports, thin it down, take off excess material, pumice it, rinse it off, put a shine on it, bag it, label it, get it ready to give to the patient. You'll spend literally about a minute and a half just taking off the supports and polishing the support area, but because it's using digital polishing, there's just a minimal amount of finishing here, and it finishes really nice. So I think it's just a really straightforward way to do this. And again, this is a very simple night guard or splint, whatever you want to call it. There may be a little excess material on the buckle. So, like, if you want to spend a couple minutes and kind of make it conform it a little closer to the teeth, you can. But it's not a very difficult concept. So again, this is the part that's going to just kind of make you crazy, right? So there are a lot of resins in the world. You don't have to really make a lot of choices here, because the DNG resin is absolutely tuned to this printer the best. Now, if you happen to believe in Keystone, like Keystone is probably one of the leaders in resin, they have both a flexible and a hard splint resin that you can use on this printer that are all approved and are validated, and you can get all those resins added to your printer if you need to. What's interesting about DNG is just how fast it prints, right? So it's basically an hour to make this thing, which is quite fast. And a bottle of DNG is under $400, but I think that's pretty reasonable to, like the flexible resins are $450 to $600. The hard resins are about $400 to $450. But when you realize, I don't know if this video is good. Yeah, you'll see just how fast this actually works. It's just the one on the right is the DNG night guard. The one on the left, that's the one that conventionally prints. So you have a bunch of support struts that you have to take off. And by the time you're really done polishing this night guard on the left, you're probably talking about like, well, in this case, I think I show 6 night guards being made. It's it's not so unreasonable that this isn't telling you the truth. You don't need to glaze these either because they're going to come out shiny. So there you have it. So conventionally, just way faster. Okay. So what I want to show you next is the most important slide I think on my whole deck. And I'm going to show you why you need to do this from a business standpoint. So I'm going to put some prices here associated. I just got to move my Zoom box around a little bit. Um, so you can appreciate this. All right. So I said that I'm going to put some prices here. So to scan a patient is going to, I'll say it takes 15 minutes of time. I think we can get a patient scanned in about 3, but I'm trying to use real world times on an average office. So if you pay that employee $28 an hour, 15 minutes of her time or his time is going to cost you $7. It will take you about 5 minutes to have somebody sitting at a computer upload that scan into the cloud. Um, Depending on your um, company you're designing with, if you will, there could be a design fee associated with designing the night guard. Like I think you saw on the Automate platform, I was talking, it was roughly about maybe $12 if I was willing to wait up to 10 hours. I'm sorry, it was $12 for waiting 10 minutes, and it was like $9 if I was going to get it back in 10 hours. So it's a minimal fee, but there's a design fee. Then you're going to have to look at your product and you're going to have to approve it. So that's 5 minutes of your time, which I'm not paying you for. Okay. Um, you'll have to get somebody to spend about 10 minutes to take the STL file of the design night guard and mount it on whatever software platform you're going to use. So we're going to say that's worth about $4.50 of their time. There's about $5.75 of resin used in order to make the night guard. I'm going to tell you that it's actually less than that, but again, I'm trying to make my numbers as high as possible. Okay. So in the fast print world, the workflow fee is $10. Remember, very similar fee in the automate world. And then if you're not in fast print and let's say you're actually polishing the night guard, it could cost 15 minutes of time for that $28 employee. So again, another $7. So I'm saying, and again, I think the costs are probably less than this, but I'd rather tell you too much than too little, right? So from the time you scan to you design, then you print it, wash it, cure it, take it off the struts, then you buff and polish and wash it, then you deliver it to the patient. That entire process is going to take us in our office a little more than an hour, and it's going to cost us about $36. Okay. Okay. This is a slide that makes sense. That bottle of DNG, I'm going to round it up to $400. It's $385, but let's call it $400. You can make roughly 80 night guards out of one bottle of DNG, which is a liter. It's a kilogram, if you will. Okay. We sell the night guard for actually more than $550, but I'm going to show you the number 550 because I don't think that's a very obnoxious number at all for a night guard. And if it costs you $36.50 in order to manufacture the night guard, then you're going to have a profit of $513.50 per night guard. So this is a crazy concept, but if you take 550 and multiply it by 80, you're going to realize that that is $40,400 of income from one bottle of resin. So one bottle of resin legitimately can pay for your entire LuxCreo solution up to 2 times, which is insane. So not only did it pay for your whole ecosystem, but it gave your patients and your employees, from the employee side, it's actually something fun to do. It gave your patients a really great benefit that they don't have to return a second time to pick up the night guard. And I think that is just really just a huge opportunity for you to really set your practice apart, to say like, hey, this is really something cool to do. And, we enjoy doing it and it's a good service. And if they call and they say, I lost my night guard when I went to Costa Rica, you can just say, I don't care. We'll just reprint it. And if you want to make up a number to reprint it, you can, because you already have that file. So I really think, if you're thinking about getting a printer, I think you could just start with this simple concept of just make night guards, and if you can do one or two a week, that's a great start. I mean, on a busy day, we make up to 5 night guards. It's just, I mean, it's something we believe in. We see, I'm an orthodontist, so we'll see about 80 patients a day, sometimes a little more, sometimes less. But, it's like on good days, we do up to 5 night guards, and this is just a huge profit, in a proper way, because it's a proper appliance. And we're just making the profit because the ecosystem that we're using is just that good. I still made night guards a lot, previous to this, but it would take us much longer to turn them around. So, I think this is kind of a daunting thing to talk about in Zoom. So, it just so happens that Glidewell is sponsoring a hands-on course at the LuxCreo Design Center, which is in River North here in Chicago, and it's a very welcoming center for learning. It's very functional. You'll get to really, really understand printing a lot by going to this hands-on approach, because not only do you physically walk out with a night guard for your, if I get my way, everyone who attends is going to get their own night guard, but you'll also design one for a patient to bring back to your practice. So the goal here is really truly to help you to learn how to use this. And the only way to do it is to make you believe it. And you'll believe it if you actually have one for yourself. But you'll walk out of this course physically designing and building a night guard, actually creating production for your practice. You'll go back and you'll deliver it. So I think if you click on that QR code right there, you should be able to go straight to a registration for the course in October, where you'll get to meet me in person and we can kind of talk more about that. So with that, I just want to summarize and say that I think these are two gigantic industry manufacturers that really get it and have designed a solution for you and I to use in a very simple manner. And it's that simplicity that really sells it for me, because we may change employees, but it's really not hard to get them to understand how to do this. And we can teach anybody how to use this workflow in just, a few hours. It's just not that hard. So I'll open the floor up for questions, and hopefully there's time here for us to answer some questions, and we can go from there.
Absolutely. Thank you so much. We do have some questions and appreciate you giving out this information. It's pretty straightforward and makes the printing night guards look easy and fast. I think you did a really good job on the ROI. It makes sense. And just for everyone to know that the fast design, the AI generated designs through fast design are free.
Oh, fantastic.
Yeah. So we do have some questions. So if they have an iTero, can you just import an STL file into the fast design software?
Yeah, there's one more piece of software with the fast design that comes with the flow automatically for iTero specifically. I'm not an iTero user, so I don't use it, but it's all done for iTero as well. So yeah, it'll import in a straight shot. So yeah. Great. So if you're an Invisalign user, for instance, and you have iTero, or you just like the iTero or whatever, this system is already set up for that.
Okay, perfect. I think Ives also has a follow-up with that, if you don't mind.
Please.
Go ahead, Ives.
Hi, my name is Ives with the Digital Adoption Department here at Glidewell. The answer to that, the direct answer to that question is you can actually import scans directly from an iTero scanner into Fast Design. There is an integration between the two systems that after you scan, it immediately sends it to the software.
Perfect. Thank you so much. Okay, Dr. Neal, do you use a rag wheel to polish after removing, or is the digital polishing all you need?
Depends where I'm at. Okay, so in one of my so in so we have 5 locations. We have LuxCreo in 2 of the 5. So what'll happen is like if I'm in a location, so literally my staff will print them and they'll like send them in the transport to the little office, right? And in the little office, I don't even have a rag wheel. All I do is I break the strut off, the support strut, and I take an acrylic burr and I take it off. And it's such a small amount that I have to adjust that it really doesn't even affect the polish. And we use those little fuzzy brushes that are like the 3M Scotch Brite brushes. So I'll touch it up with that a little bit if I don't feel that it's smooth enough. But I don't even use a rag wheel and pumice on it because it's so clear. It's coming off the printer so clean and clear that I don't want to mess with that. In my main office, if my staff is doing it, they'll tend to pumice them, and they will use a rag wheel. But when I say it's like a 30-second pumice, it's not even that. It's just because that's what she's set up to do, and she just does it that way.
Okay, sounds like it's a lot more efficient nowadays.
Yeah.
Awesome. And then does the design differ when there is a bite registration involved?
No.
Perfect. And then I have a couple questions on 3Shape. So between you and our panelists, we might be able to get some answers. So
Sure.
what is the total cost of the LuxCreo ecosystem? I'm not sure.
I could take that one. All right. Hi, my name's Dia. I'm on the Glidewell team. I'm the brand manager here for the fast print. So the purchase price for the fast print 3D printing solution, which is the LuxCreo ecosystem you saw, plus Glidewell support and training included, plus the fast design software for AI generate night guards and models and retainer designs, is $16,990, and we always have financing available.
Great, thank you. And then this might be more for Dr. Neal, but what's the cost of the 3Shape design that you're using?
Again, it'll vary based on whether I need it back immediately or if I can wait to do it at the end of the day. It's somewhere between $9 and $12.
Okay, perfect.
It's nothing crazy.
And then the more time, if you give them a little bit more time, you save more money. So that sounds like
You save about $3, $4, yeah. So it's a matter of the way I'm wired, because I go to multiple locations. If someone's and I'm very fast to suggest night guards now because I just believe in them so much, and they're way more durable than anything I can give a person from an aligner standpoint. So what I say to people is like, if and I sell them because I can flip it so fast. But typically what I want to do is I want to scan them. And if I know they say yes to the night guard, I just push it off into the design software immediately. So I will upload it into design when I'm with the patient at the chair. I don't care when I'm giving it to them, but I just want to put it into design. And then at the end of the day, I just always look at my platform and say, what's in there? And then I'll understand like, oh, we made 3 night guards today, and then we kind of do our back channel, like, did we charge for 3 night guards? Because sometimes we forget to charge, and like, oh, did we do a delivery appointment? It's like, did they get it that day? So those are the things, it's kind of a checks and balance system for us.
Gotcha. And then does LuxCreo ship resins worldwide?
You do.
Perfect. And then somebody is asking if you can just reiterate, they missed the beginning. Does the fast design system work with other printers?
The fast design is really optimized for LuxCreo because the language that the LuxCreo printer is using is, it's designed for that. On the other hand, what's being exported is an STL file. So STLs are usable files, right? So again, if you had a different printer, you could theoretically do it. But I think the selling point here is you want the ecosystem. It's not that you want fast design software. You want the whole package because that's where it's completely tuned as a package. And like that whole thing, like, really 40 grand worth of production out of a single bottle of resin is like insane, right? So again, if you just do night guards, you paid for your system almost 3 times, right? Because it's about 17,000 for the system. So I think, the magic here is that I think Lux and Glidewell were very pragmatic about how they priced this system, because this system is priced a lot higher in other areas. Like if you try to buy this system piecemeal, like outside of this, it's much more expensive.
Yeah.
So I would say, no, you're going to buy the whole system because it's designed to work together. If you have a spare printer in your practice and let's say the Lux is busy, could you put it on another one? The answer is yeah. I'm like, would I recommend it? Probably not, because the light generator in the LuxCreo is so high quality. I mean, that's what creates the digital printing, right? And it's not just that it's digital printing, it's digital polishing. And it's not just that it's still digital polishing, it's digital polishing in under an hour, or about an hour. It's all that. So so you don't really want to split this apart.
I think that's a great answer, and I think it's perfect for ending this webinar. Thank you so much for your time and expertise today, and I hope everyone enjoyed today's lecture, and we hope to see you again for another topic someday. Thank you so much, and have a great day.